71-year-old man died in his sleep. 4 bedtime habits you must avoid after 70. You've probably heard stories about elderly people who seem perfectly healthy on the outside, but suddenly pass away without warning. A 72-year-old man with no signs of illness was as cheerful as usual, but the next morning he didn't wake up. What happened? Is it something we can prevent? The truth is, after 70, some habits that seem harmless at night can have a serious impact on health, increasing the risk of heart disease, stroke, and even sudden death. What's worse is that many of us are still unknowingly engaging in these habits. In this video, we will explore 4 nighttime habits you need to avoid once you're over 70. These small, seemingly harmless habits can have a big impact on your health and longevity. Some of these might surprise you, and you might have been doing them for years without realizing the risks. Stay tuned until the end to learn about the final habit, one that many elderly people unknowingly practice every night, that could be putting your health at serious risk. You'll also learn how to change these habits for safer, healthier sleep every night. Let's get started. 1. Eating heavy dinners. One of the most dangerous habits many elderly people have is eating heavy dinners, especially too close to bedtime. You might think this isn't a big deal, and maybe you've been doing it for years without any problems. But in reality, after the age of 70, our bodies no longer process food the same way. When you have a full meal or even just a light snack close to bedtime, your body continues to work on digestion, which directly affects your sleep. Instead of relaxing and preparing for a deep rest, your body is still digesting food, producing stomach acid, and raising your heart rate, all of which prevent you from having a restful, peaceful sleep. If you wake up in the middle of the night feeling bloated, having indigestion, or even experiencing heartburn, your dinner might be the culprit. In fact, eating too late can increase the risk of heart disease and even stroke because your body has to work overtime to process the food while you sleep. And if you eat fatty or hard-to-digest foods, stomach acid can reflux into the esophagus, causing discomfort or even coughing or vomiting. One of the more serious consequences of late-night eating is the risk of gastroesophageal reflux disease, GERD. If this condition persists, it can cause inflammation, weaken throat muscles and the respiratory tract, and even lead to aspiration pneumonia, a dangerous disease, especially for the elderly. So what should you do instead of eating a heavy meal before bed? The answer is simple. Eat your dinner at least 3 hours before you go to sleep. This gives your body enough time to digest the food, minimizing risks to your digestive system and heart. If you need a light snack before bed, choose easily digestible items like a handful of cashews, a small piece of fruit, or a warm cup of herbal tea. These options are not only good for your health, but also help you enjoy a better night's sleep without overburdening your body. So remember this: the food you eat at night can deeply affect your sleep and health. Take care of yourself by adjusting your eating habits, allowing your body to rest properly at night. 2. Drinking too much water before bed. Everyone knows that staying hydrated is essential, especially as we age. However, one habit that many elderly people don't realize is that drinking too much water in the evening can cause serious health problems. If you frequently wake up in the middle of the night to go to the bathroom, it's a sign that you've been drinking too much water before bed. This not only disrupts your sleep, but also increases the risk of falls, high blood pressure, and even memory decline if this persists. Why is that? As we age, the bladder doesn't hold water as well as it used to, and the kidney's ability to filter water also declines. Drinking too much water in the evening increases the likelihood that you'll have to wake up to urinate during the night. Each time you wake up, you'll need to turn on a light, which confuses your body into thinking it's morning, disrupting the production of melatonin, the hormone that helps you sleep. This not only causes discomfort, but can also lead to dangerous incidents. Imagine waking up in the middle of the night, feeling the urge to pee and rushing to get out of bed. But when you stand up, your blood pressure hasn't adjusted yet, and you could feel dizzy or even fall. This is one of the main causes of serious accidents, especially for the elderly. In addition, waking up multiple times can disrupt your sleep, leading to a decline in sleep quality. Each time you wake up, you miss the chance to enter a deep sleep, which weakens your immune system and increases the risk of illness over time. Poor and insufficient sleep can also lead to high blood pressure and even memory problems like dementia. So how can you stay hydrated without disrupting your sleep? The answer is simple. Adjust your drinking habits. Try to drink enough water in the morning and afternoon, and limit your water intake in the evening. If you're thirsty in the evening, only take a small sip instead of drinking an entire glass. And remember that caffeinated drinks like tea and coffee in the late afternoon will increase the amount of water you need to expel, worsening your nighttime bathroom trips. Another helpful tip is to pay attention to hidden sources of water in your diet. Soups, fruits like watermelon or oranges, and some medications can also contain a lot of water, contributing to the likelihood of waking up during the night. Be mindful of how much water you're consuming from all sources to ensure you get a truly restful and healthy sleep. 3. Sleeping in an overly warm room. When you think of a good night's sleep, you might imagine a warm and cozy room. However, for elderly people, sleeping in a room that's too warm can lead to serious health problems that you might not be aware of. As we age, our bodies lose the ability to regulate temperature as efficiently. The sweat system and the ability to release heat decrease, making the body more prone to overheating. If the room temperature is too high, the body has to work harder to maintain a normal temperature, which can put stress on the cardiovascular system, especially for those with a history of heart disease or high blood pressure. A night spent sleeping in a room that's too warm will not only leave you feeling tired and irritable the next morning, but it can also increase the risk of dehydration. Even if you don't feel thirsty, slight dehydration during the night can make the blood thicker, making you more prone to cardiovascular diseases, stroke, or even blood clots. You've probably experienced waking up in the middle of the night, feeling sweaty and uncomfortable. This is a sign that your body is struggling to maintain a stable temperature. When your body temperature rises too high, it can prevent you from reaching the deep sleep stages that are necessary for recovery and maintaining good health. This reduces the quality of your sleep and causes you to wake up feeling tired and groggy. So, how can you get a good night's sleep without harming your health? The answer is simple. Keep your bedroom cool. Experts recommend an ideal sleeping temperature of 15 to 20 degrees Celsius, or about 60 to 67 degrees Fahrenheit. If you feel cold, instead of using a heavy blanket, you can opt for a lightweight cotton blanket that keeps you comfortable while maintaining a proper temperature. Another tip is to use a fan or open the window to allow air circulation. This not only helps you sleep better, but also improves the air quality in the room, reducing the risk of respiratory problems. Try this today, and you'll notice the difference. 4. Sleeping in the wrong position. You might not think that your sleeping position can affect your health, but after the age of 70, the way you sleep can have a significant impact on your body often without you realizing it. Sleeping in the wrong position can lead to serious issues with respiration, blood circulation, and even increase the risk of stroke or heart failure. As we age, our bodies begin to change. Muscles weaken, lung function decreases, and blood circulation is no longer as efficient as before. If you sleep in an improper position, your body can experience problems such as sleep apnea, high blood pressure, or even heart disease. For example, sleeping on your back, although it may feel comfortable, is not an ideal position for the elderly. When lying on your back, your tongue and the soft tissues in your throat can easily fall backward and block the airway. This can lead to sleep apnea, where you temporarily stop breathing for a few seconds and then gasp for air. This not only disrupts your sleep, but also increases the risk of cardiovascular problems, high blood pressure, and potentially a stroke or heart attack. If you often sleep on one side, especially the right side, this can put pressure on the heart and reduce blood circulation. This is particularly dangerous for those with heart problems, as it can lead to blockages in circulation and prevent the body from getting enough oxygen and nutrients. So what's the ideal sleeping position after 70? Experts recommend that elderly people should sleep on their left side. This position helps improve blood circulation, reduces pressure on the heart, and even aids in better digestion. If you find it difficult to maintain this position throughout the night, you can try using a large pillow or body pillow to keep your body in a left-leaning position. Another helpful tip is to slightly elevate the head of your bed. Raising the head of your bed can help reduce acid reflux and improve respiratory function, especially for those suffering from heartburn or acid reflux. Keeping your airways clear is crucial for a good night's sleep and for avoiding respiratory problems. Sometimes, just changing your sleeping position can help relieve joint pain, improve blood circulation, and reduce the risk of serious health issues. Try adjusting your sleeping position and see the difference for yourself. We've explored 4 seemingly harmless habits that can actually be dangerous to your health, especially once you hit 70. From eating too late, drinking too much water before bed, sleeping in a room that's too warm, to sleeping in the wrong position, all of these can negatively affect your sleep, cardiovascular health, and overall well-being. The good news is that these habits can be changed. By adjusting these small habits, you can improve your sleep quality, reduce the risk of serious health problems, and wake up every morning feeling healthier and more energized. So what about you? Have you noticed any of these habits in your daily life? Try making a few small changes today and see how your health improves. Don't forget to share with us what you've learned from this video and the changes you'll make to take better care of yourself. Thank you for watching this video. If you found the tips useful, please like, subscribe to the channel, and share with your loved ones so you can all improve your health together. And don't forget to turn on the notification bell so you won't miss the next videos. Wishing you restful sleep and waking up healthy every day.